let me talk about quintiles in Latin America, because one of the best way to convince the customer to work in Latin America is to invite them to visit us in any of the countries.
One of the things that the customers like the most is enthusiastic people, not only quintiles, but especially in quintiles, but also investigators and study coordinators. They're like a sponge. They like to learn. We like new things. We like to try new things. And second, as the patient, the access to patients. First of all, we are concentrated on big cities. Just Sao Paulo alone has almost 18 million inhabitants. There are 23 countries in Latin America, and we covered the whole 23 countries, so we can say easily that we have the large presence in the region. So first of all is the size of the population, and second, the diversity of the population. The beauty about Latin America is their geographic spread. From Mexico, that we are close to the equator, and then we have a pretty much steady climate, to Argentina, where we have very fixed season. We can conduct clinical trials in the whole region, and from north to south. In Argentina, for instance, we can do some clinical trials that we cannot do anywhere else, but similar to Europe.
Since 1995, I can see a tenfold increase on the number of trials in Latin America. Customers are now looking to our region as they used to look to North America and Europe.
The infrastructure in Latin America is what surprised the most, because people were expecting, they have a preconception view or ideas of what are the hospitals, etc. But a large, and I would say at least 10 to 20% of our physicians receive some type of training from overseas, whether they move to other countries, and especially it's true in Brazil.
The customers discover that we have very good investigators, a School of Medicine, regulatory agencies, capability in terms of monitoring activities, good results, top recruiters in every clinical research we are participating. So they discovered the value for working in Latin America.